A partial or complete bed bath is given to a resident who cannot, for medical reasons, tolerate a shower or tub bath. During the procedure, you will need to maintain privacy, keep the resident safe and warm, move all limbs gently and naturally, avoid force and overextension of all limbs and joints, uncover, wash, rinse, and dry one body part at a time to maintain the resident's privacy and warmth. Work from clean areas of the body to dirty areas. To do this, begin by washing the resident's face and work down the body. Complete the front of the body first, then the back. Remember, bath time is also an excellent time to observe overall skin condition. Note and record any areas of redness, bruising, rashes, lumps, or skin breakdown. Pre-steps include checking the plan of care, washing your hands, gathering your supplies, knocking, waiting, introducing yourself, identifying the resident, providing privacy, and explaining the procedure.
Hi Kathy, I'm Margie, a nursing assistant, and I'm going to give you a bed bath this morning.
Oh, okay.
To prepare for the bath, fill the basin with warm water. Check the water temperature with your wrist or the bath thermometer. If using the thermometer, it should be at 105 degrees Fahrenheit. The resident should check the water temperature as well to make sure it is comfortable for them. Raise the side rail opposite where you will stand. Standing at the bedside opposite the side rail, raise the bed to a working height. Remember, you are now acting as a side rail. Do not move away from this side of the bed. Cover the resident with a bath blanket or a top sheet, then remove or fold back the top linen.
I'll just take off your gown here.
Remove the resident's soiled gown. Put on gloves before washing the resident.
Just put your arms in.
To begin the bath, place a bath towel across the resident's chest.
Kathy, would you like to wash your own face?
Fold the washcloth into quarters. Wet and wring out the washcloth. Wipe the eyes from the inner corner to the outer corner. Wash the other eye in the same manner, turning the cloth to a clean section for each wipe. Rinse and wring out the washcloth. Ask the resident if they want to use soap or plain water to wash the rest of their face. Apply soap to the washcloth if requested. Wash the face, neck, and ears using firm but gentle strokes. If soap is used, you would rinse and wring out the washcloth and wipe the face, neck, and ears again without soap before moving on. Dry the resident's face, neck, and ears with a towel from the chest. Continue by washing the arms. Uncover the arm farthest from you, placing the towel under the arm. Assist your resident to move to the side of the bed closest to where you are standing. Wring out excess water to avoid getting the bed linen wet and apply soap to the washcloth. While supporting the resident's joints, use long, smooth strokes from shoulder to tips of fingers. Wash the armpit. Rinse and wring out the washcloth in the basin. Then rinse arm, underarm, and hand. Return the washcloth to the basin. Dry the arm, armpit, and hand using the towel from under the arm. Cover the arm with a bath blanket after drying to keep the resident as warm as possible. Place the towel under the arm closest to you. Pick up the washcloth in the basin, rinse and wring out, and apply soap. Wash this arm following the same step as used in the first. When finished washing and rinsing the arm, return the washcloth to the basin. Dry the arm and underarm and hand with the towel, and place the towel across the resident's chest. To wash the chest and abdomen, pull the bath blanket down to the pubic area. Rinse and wring out the washcloth. Apply soap to the washcloth. Keeping the resident covered as much as possible, lift the towel only enough to wash the chest and abdomen, but not touching the pubic area. Be sure to wash under any skin folds, such as under the breasts. Also check the skin folds for redness, rash, or other signs of irritation. Rinse and wring out the washcloth in the basin, and rinse off all soap from the chest and abdomen. Return the washcloth to the basin and dry the chest and abdomen, being careful not to touch the pubic area with the towel. Offer to apply deodorant. Cover the resident with a bath blanket. Lower the bed. Give the resident the call light.
And here's your call light.
Check water temperature. To wash legs, uncover leg farthest from you. Place the towel under the leg. Wring out a clean washcloth and apply soap. Wash the front and back of the leg, starting at the top of the thigh and working down to the toes, including between the toes. Rinse the leg in the same manner as it was washed, including between the toes. Dry the leg and foot, especially between the toes. Cover the leg for warmth. Uncover the leg closest to you and wash using the same steps. After washing, rinsing, and drying the leg, recover the leg for warmth. To wash the back, turn the resident away from you.
Just going to have you roll to the other side of the back here.
Place a washcloth and towel in the laundry bag. Put a clean bath towel on the bed along the resident's back. Using a clean washcloth, place in water, wring out, and apply soap. Wash from the neck down the back. Rinse the washcloth in the basin, wring out, and rinse the back from the neck down. Dry the resident's back. Apply lotion to the back by pouring lotion into your gloved hands and rubbing it onto the back with firm, smooth strokes. Wipe off any excess lotion with a towel. With the resident still on their side, place a waterproof pad under the resident's buttocks. Assist the resident to a supine position with waterproof pad under buttocks in preparation for pericare. Pericare, which completes the bed bath, will be demonstrated on a female mannequin. Perineal care is done as part of the bathing process, with each incontinent occurrence and as necessary. Proper cleaning of the genitals helps prevent odors, skin irritation, and assists in prevention of urinary tract infections. Remember to maintain privacy, expose only the area being washed. Uncover the resident to expose their legs and perineal area. Position the resident with knees bent or legs spread to expose the peri area. Place a towel over the abdomen above the pubic area. Place quartered washcloth in basin and wring out. Apply soap to the washcloth. Wash perineal area, spreading labia. Use a clean area of the washcloth for each stroke. Dispose of this washcloth in the laundry bag. Using a clean, quartered, wet washcloth, rinse the perineal area. Remember to always move the cloth from the front to the back of the body, using a clean area of the washcloth for each stroke. Dry the pubic and peri area with a towel. Keeping the towel on the bed, assist the resident to turn on their side facing away from you. If bathing a male resident, you would turn them on their back and proceed with the following steps being demonstrated on the male mannequin. Place a quartered washcloth in basin and wring out. Apply soap to the washcloth. Wash the tip of the penis in a circular motion. Wash the shaft of the penis from tip to base using a clean area of the washcloth for each stroke. If the resident is not circumcised, push the foreskin back to reveal the tip of the penis. Wash the scrotal sac, checking closely for any areas of skin irritation or breakdown. Rinse using the same techniques. Dry the perineal area. If the resident is not circumcised, replace the foreskin to a normal position. Keep the towel on the bed and assist the resident to turn on their side facing away from you. For a person wearing a brief, place a waterproof pad under the resident's buttocks by turning the resident away from you towards the raised side rail. Assist the resident onto their back. Proceed to remove the soiled brief. Release the closures, fold front of the brief down into itself. Assist the resident to turn away from you, removing the soiled brief and disposing of it in a waste container at the bedside. Wipe off any excess feces with toilet tissue before turning the resident onto their back for pericare. If your gloves are visibly soiled, remove, wash your hands, and apply clean gloves before resuming care. Apply soap to the washcloth and wash the area around the anus and buttocks, from the front of the body to the back, using a clean area of the washcloth for each stroke. Rinse the washcloth in the basin, wring out, and rinse the anal and buttocks area with the same motions. Dry the area. Remove the waterproof pad and soiled gloves. Wash your hands and apply clean gloves.
And we'll just get a clean gown on here.
Assist the resident to apply the clean gown or clothing as desired. Pull up bed linens, remove the bath blanket, and lower the bed and side rail. Meet your residents' needs. Put on clean gloves, clean equipment, and return to designated area.
I'm so excited about going down to get lunch.
Yeah.
Remove gloves, wash your hands. Remove and dispose of soiled equipment and linen. Wash your hands, note, record, report per facility protocol.